Now, non-communicable diseases, including heart disease, stroke, cancer, diabetes and chronic lung disease are collectively responsible for 74% of all deaths worldwide. More than 3/4 of all non-communicable disease deaths and 86% of the 17 million people who died prematurely or before reaching 70 years of age occur in low and middle income countries. For more insights on this, we're joined by medical practitioner Dr Siviwe Mila. Dr. Mila, thank you so much for joining us on the weekend edition of News at Prime. Alarming statistics here. Why aren't we talking enough about these NCDs? And if you could just give us a definition and breaking it down.
Yeah. Thank you so much, Masa. Thank you so much, and good evening to your guests. So, unfortunately, it's one of those what we term silent killers. And in a country like South Africa, there's been a lot of talk about HIV and AIDS for a very long time. And I think, we're moving more to having such conversation, especially with the NCDs, meaning non-communicable diseases. These are the diseases that you're not going to get just by like coughing, like TB, that you get it. It's mainly what we call diseases of lifestyle. So we're talking about your cancers, we're talking about your cardiovascular diseases, which include your heart attacks and strokes, and also talking about respiratory diseases, mainly your chronic obstructive diseases, so like diseases that you get from smoking or other people working in the mine environment. I mean, if you remember the story about asbestosis, why it needed to be changed. So those type of the diseases that we're talking about. And within the context of South Africa, unfortunately, we are one of the countries that are quite high when we talk about obesity. So when you speak about obesity, we're speaking about when we're looking at your weight and your height, and it must not be more than 30. So if your BMI is more than 30, then you are classified as obese. And unfortunately, in South Africa, we still have a lot of obese people. So it's more how we are leading in terms of what we eat, lack of exercise, also the smoking, and just those factors that are looking into the NCDs.
So in a way, there is a way that you can try and avoid some of these diseases. Correct.
So leading a healthy lifestyle, number one, and also it doesn't need to be inexpensive. So what we generally say to the people out there is that moroho, you just get it from your garden. And if you're talking about certain types of food, doesn't need to be white pap, it can be the brown pap. So those healthy options, people tend to think that healthy living is expensive, that you need to buy all these vegetables from these expensive supermarkets, but it's not like that. Also, a big thing that we need to speak about, Masa, is people getting active. So at least 30 minutes a day, every single day for 5 days. That's going to give you just, that what you should be covering. And you don't need to join the gym. This could be just walking up and down the stairs if you're going to work. If you don't have the 30 minutes at once, dividing that into 15 minutes twice a day. If you don't have the 30 minutes, doing 20 minutes, but more intense, meaning that your heart needs to beat a bit faster than what it does when you're just walking normally.
Dr. Mila, as you're speaking of moroho and foods like that as well, a lot of us grew up also eating such foods as well. But then with also urbanization, there's a lot of development, and the takeaway food is delicious and it's convenient and it's quick as well.
Convenience, definitely. But when you look at it, and I mean, remember, and the beautiful thing about the country, when Dr. Aaron Mutswalidu, who's back now at Health, when we're looking at cutting down, and they cut down the sugars and they cut down the salt, people were like, no, this soft drink doesn't taste the same anymore. In the back of the government's mind is to try and reduce the sugar content that we're taking in. Because if you look at, that beverage that we can't name right now, the amount of teaspoons of sugar that are in there, if you were to count it, you would not pour that much sugar in your coffee in the morning. So those are the type of conversations, and those are the type of legislations that people in higher powers are putting in. So it is us having to be conscious and having these talks more and over and again, because we have, I think, doing so well when it comes to the HIV front, but we are lagging when it comes to NCDs. And unfortunately, we see lots of people that are affected by strokes. I mean, just this week, unfortunately, one of the musicians in South Africa is affected by one. So these are things that are happening. It's not in void. And I mean, according to the statistics, every hour, 10 people get a stroke in South Africa.
Sure.
So by the time you finish your show, about 10 people would have had a stroke, and 5 people would have had a heart attack. So those are the alarming numbers. Wow. And unfortunately, we're not talking enough about those.
That is shocking. That is shocking when you put it that way as well, that it's just within an hour. And also speaking about, you know, you made mention as well about strokes and how it's affected one of South Africa's popular musicians as well, but also he's not the first. We know that, for instance, the songstress Lyra came out publicly about also suffering a stroke too. And it just seems that even according to the statistics that it's younger and younger people who are suffering from these diseases.
Correct. So one other thing, Masa, to look at is that you've got different factors. So you've got your age, you've got your sex that affects. You've got also factors that are controllable, like the weight that we spoke about, speaking mainly to your BMI. Also smoking and, you know, illicit drug use or whatever it is that other people are using. But also the fact that at home, if you have had a parent that has had a stroke, the chances for you to have a stroke are much higher than someone who's coming from a family that, you know, they don't have high blood pressure. And that's the biggest thing as well, that the most strokes that we see in the country are as a result of what we call high blood pressure. So when you go to the clinic, I always say, you know, we've got the top number, the bottom number. And the top number is just telling us that your heart as a muscle is pumping out. So that's just systolic. So that's the pressure your heart needs to pump so that the blood goes to all the beautiful veins in your body, veins and arteries. And the bottom number, that's when the heart now is relaxing so that it can fill up again. So that top number, it should not be more than 140. So if you're sitting at 140 and above, then we're saying that you've got high blood pressure. The bottom number, if it is 90 and above, then we also say that you've got blood pressure. So it doesn't need that both numbers have to be, you know, 140 over 190. It could be either or. And unfortunately in South Africa, because, you know, we don't talk much about these, and a lot of people are like, no, you know, just a little bit of headache here and there, but when you check their blood pressure, probably sitting at 160 over 95. And the person will be like, no, doc, I don't take those medicine anymore, like, I feel better. And unfortunately, they're silent killers. It's not like when you break a bone that you see your bone is broken and you feel the pain. So it's the constant education, and that people must continue adhering to their medication, because they'll be like, no, I feel fine. But until your doctor says, okay, right now, you're getting hypos, meaning that those numbers are dropping, let's just stop the meds, then you can stop, but not just stop in isolation.
And what contributes to a high blood pressure, and what are the consequences and the risks of having a high blood pressure?
Okay, mainly salt, 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 salt. So people will tell you that, no, doc, I've stopped taking salt. I'm taking that, you know, the yellow powder that we also can't name, like in terms of food. But if you look at the very first ingredient that's in that yellow powder is sodium chloride. And that's the biggest thing that we have an issue with when it comes to high blood pressure is the sodium. So whatever type of spice, whatever thing that you're using, if you look at the ingredient and the first name is sodium, ideally you should not be using that. So your paprikas, your thyme, your oregons, like those are the ideal spices that you can use, and even like your black peppers to make food flavorful. Because a lot of people feel that if you've got high blood pressure, you just have to have bland food, and that's not the case. I mean, there's so many active ways now of making sure one can create food. So that is the biggest risk factor. The fact that it's our diet, and also, you know, not moving, not exercising, as we said, the obesity element, you know, the overweight, smoking as well. And I mean, if you just stop smoking for 30 minutes, your blood vessels, like there's a big difference. If you stop for 2 days, if you stop for a week, you know, they are very, there are lots of benefits. We know it's hard for people to stop smoking, but I generally say that if you're usually taking a packet of cigarettes a day, you know, cutting that to about half a packet a day, and you're moving to 2 cigarettes a day, that you taper it off. Yeah.
You know, we live a very busy, active lifestyle as well. Many people stuck in traffic, from traffic to dropping off kids and going to work and sitting behind a desk and eating food of convenience as well. And earlier you were mentioning that you actually don't have to sign up at the gym. You can walk up and down the stairs, for instance, of your house or at work as well, if there's stairs there too. What other tips would you give people who live like a high pressure, intense lifestyle? Yeah,
so if you remember COVID time, so we were not even allowed to be on the street. It was so interesting how people were doing kilometers in their yards, you know, so I think it just should be a culture that we're adopting. But I think another important thing is that, especially if you're leading that hectic lifestyle, you know, do 15 minutes in the morning, do another 15 minutes at night when you're winding down. So be it that it's stretching. I always say for me, skipping rope works better because it's almost like a fun activity actually takes me back to my childhood. But in that, it's inexpensive. I can do it in the convenience of my house. And also, you know, the kids tend to join along, and it's a whole family activity. So whatever it is that works for you and whatever it is that you like, because I know other people will be like, no, I've got knee pain, I can't do skipping. But whatever it is that's going to make your heart pump. And for people that say, no, I like to take walks, make sure it's a brisk walk. Because next thing, if you're strolling, you're not getting the benefit of making sure that your heart is beating as fast as it should to give that exercise element.
We've spoken about strokes and heart attacks.
Yes.
Diabetes, how big of a problem is that?
It's a big problem, it is. And I know, I mean, towards the end of the year, usually around the time of awareness, we speak about it. But I think the biggest part with the diabetes element as well is that because South Africa is dealing with this obesity crisis, we're also dealing with childhood obesity, meaning that even our children are overweight for the ages that they're supposed to be at. And that increases their chances of getting diabetes later on. Even when we come to pregnant women, if you have diabetes during your pregnancy, it is probably that it's pregnancy-induced diabetes, meaning that when you're pregnant, your body's under a lot of stress. So what happens is that certain conditions come up, but that is almost like showing that in the future, the likelihood for you to have that condition is quite high. So it's quite important that we start also leading a healthy lifestyle, especially when relating to the children one, because you're picking up a lot of kids that are dealing with obesity and having diabetic problems later on.
Sure. And when it comes to also just moving forward with looking at how younger people as well will not be affected by this even more, because I think that's what's also concerning about the new stats that have come out to show that it's younger and younger people who are suffering from these kinds of diseases as well. Should you then be around someone, for instance, who suffers from a stroke? I mean, younger people will hang out more together. So let's say you're out in a social setting. What are the signs that you look out for to know that this is what the beginning of a stroke looks like? Earlier when you were talking about somebody who may have a headache and maybe just ignoring it, what are the telltale signs if you're sitting next to somebody or near somebody and they start to fall ill in front of you? What are those signs that we should be looking out for?
Yeah, so we talk about what we call be fast, so like fast, so like mainly facial asymmetry. So like you can tell that while I'm talking this interview, like next thing my face starts drooping. So you'd find that the one side is not the same as the other. So like they just totally have no sensation on the other side. Literally they'll look like this when you look at them. And also then also in terms of their speech is, not coming out nicely. So they can have like a slow speech. Sometimes they say it feels like almost their tongue is quite heavy. And then the important things when you're looking even at your arm, so you'd ask them, like, can you put your arm straight? And then one is just constantly dropping. They can't put it up, it just drops. So those are the things that you watch out for, even on the limbs. But the most important thing is that, like, when you see those signs, please get them to a healthcare, ideally a hospital, within an hour. Because within the first hour, we have seen what we call the golden hour. It limits disability significantly. So if you get to the hospital, depending on what type of stroke, because you get two types of stroke mainly, what we call an ischemic stroke, meaning that it's a blood clot that's closing off your vessel. I'm not sure if they can show the image, if they've got... when you've got this beautiful brain that's got all the blood vessels to take blood to the rest of your brain, but with an ischemic stroke, it's almost like there's a blockage. So that part dies off. And depending where it happens in your brain, it can either affect your speech, your mobility, or whatever it is where, that clot was. Also, you get what we call hemorrhagic stroke. So this is when, remember, the brain is quite in a hard container. And when there's a vessel that bursts open, there's no space, for the brain to go too much. So that part also tends to die off. So the first hour becomes very, very important to try and limit disability.
Fascinating stuff, and also quite alarming too. And I'm glad that we are talking about this thing that has become a silent killer as well. Dr. Mila, thank you so much. And I guess the importance of being fast.
Yes, being fast.
Thank you so much for your time
so
and
much,
joining
Masa.
us in studio.